Hi everyone, I'm Megan. I'm the dietitian at Help in Corktown Health Center, and this video is going to be the first of 6 weeks of instructional videos on the DASH diet. So each week I will be going more in depth on a separate topic, and I will also be posting cooking demo videos that correlate with the topics for each week. If you have any questions on any of the topics or the talks, feel free to leave a comment in the YouTube comment section and I will check those and get back to you. I hope you enjoy these next 6 weeks. Hello everybody and welcome to week 1 of the Keep It Moving DASH Diet and Mediterranean Nutrition class. So for this first week, we're just going to review what the DASH diet is, which is similar to the Mediterranean diet. We're going to talk a little bit about BMI and discuss some main points in kitchen safety. So what is the Mediterranean diet or the DASH diet? So they are very similar diets. The DASH diet stands for Dietary Approaches to Stopping Hypertension. So it was made specifically for those with hypertension or cardiac issues who would benefit from a lower sodium diet or other aspects of a diet that would be good for cardiac health. So the Mediterranean diet just by itself is lower in sodium and has other factors that the DASH diet would have as well. So they are both really high in fruit and vegetable intake, specifically vegetables even. Vegetarian protein sources, things like beans, nuts, and seeds, those are encouraged to be eaten in higher amounts than things like meat. So it's also high in whole grains, and we will dive into more of what whole grains are specifically in another week. Again, it is moderate in lean meats, which would be meats like pork, chicken, those are lean types of meats, and also moderate in seafood intake. It would be low in the red meats, so that would be things like beef. It is also low in refined grains, which are the grains that are not whole, and these are less natural, so they are more processed. And again, we will get into that more specifically in another week. And it is also low in added sugars. These sugars are different than the natural sugars found in fruits, but we will dive into that more specifically on another week. These diets are also limited in sodium, trans fats, and saturated fats. The nice thing about both of these diets, though, is that there is no calorie counting. So it's more on just kind of what you feel, when you feel like eating and how much you feel like eating. But as long as you're following these main aspects of the diets, then you're following the DASH diet or the Mediterranean diet. So what are the health benefits of these diets? You have a decreased risk for developing things like hypertension, cardiovascular disease, fatty liver disease, heart attacks, kidney stones, type 2 diabetes, certain types of cancers, and strokes. So when you follow these diets, this kind of decreases your risk for those health issues. Why is hypertension dangerous? Why would we want to reduce risk of hypertension or reduce the effects of hypertension? So it can lead to damaged arteries. Hypertension has to deal with the amount of blood that is going through your veins and your arteries. So when you're altering what the blood flow should naturally be like, this can cause issues. Aneurysms, again, have to do with blood flow. An enlarged heart, an ischemic attack, which would be like a stroke as well, dementia, kidney failure, retinopathy. This could be issues with sight, loss of sexual function in men, sleep apnea, and bone loss as well. The DASH diet can also, and this also pertains to the Mediterranean diet, but it can lower your total cholesterol levels, which is a positive thing, be an alternative to blood pressure medications. So some people find that when they start following the Mediterranean diet or the DASH diet, they actually can decrease the amount of blood pressure medications they're on, or they can actually just come off of it completely, which is a really awesome aspect of these diets. And they can also possibly help prevent or delay deterioration of cognitive function related to aging. So this has to do with the brain. So what is BMI? Basically, it is just a measurement based on a person's height and weight. So it has to do with your sex as well as how it is calculated. There is a different calculation for men versus women, which you can probably already start to see some issues with that. There are 4 main categories for BMI measurements. So after your BMI is calculated, it can fall into one of the 4 categories, which would be underweight, normal weight, overweight, or obese. So the BMI, again, another issue with it is that it doesn't differentiate between fat and just general weight or things like muscle. So your higher BMI may not actually be due to additional fat. It also does not take into consideration fat distribution. So what I mean by that is you may fall into the overweight BMI category, but this does not necessarily mean your weight is a risk factor for certain diseases. So there are different fat distribution body shapes. Some are correlated with increased risk for diseases, while others are not. You may have heard of the apple versus pear shape. So that just speaks to where the fat is distributed in your body. The apple shape means you have more fat around your midsection. This is the body shape that is correlated with a higher risk for health issues typically. The pear shape means you hold more weight in like your hips, but your waistline tends to be smaller. This is associated with a decreased risk of health issues. Again, this is just very generalized. If you are an apple shape, it does not automatically mean you are going to get a certain health issue, right? It is just a way to measure a risk. So even though your BMI may be in the overweight or obese category, you may be perfectly healthy. Unfortunately, this is still generally widely used, but I like to focus more on fat distribution and waist circumference size more so than BMI. So basic kitchen safety. How can we be safe in the kitchen when we're cooking? The DASH diet, the Mediterranean diet, we encourage cooking at home more so than going out to eat, right? Because often when you're cooking things at home, it's just automatically going to be healthier than something you would find at a restaurant. Things at a restaurant are often a lot more processed. They have more things like added sugars, the fats that we don't really need or want as much in our diet. So it's typically a better choice to cook things at home. So if you are not someone who has done a lot of cooking at home, there are basic kitchen safety topics that it's important to go over. When you are cooking, you often want your hair, if it's longer, to be tied back or covered. This can, help prevent things like fires or just injury to yourself. You always want to be careful with your hand washing, especially right now when we're in a pandemic. This is especially important. So you always want to wash your hands before you ever start any part of your cooking. So again, you want to use soap. You want to scrub your hands with the soap for at least 30 seconds and then rinse and dry really, really well. It is also important to wash your hands just like the way I described after you handle raw meat. This is because raw meat can carry a lot of pathogens or bacteria, which when it's cooked, they are killed during the cooking process. But when they're raw, the increased risk for these bacteria are increased. You also want to wash your hands after touching your hair, your face, your cell phone, your clothing, and things like that. So if you have a cut on your fingers, usually you can put a Band-Aid on it, and the best way to reduce any bacteria getting in your cut or spreading any bacteria from the cut is to put a Band-Aid on, and then you can also put a glove on as well. There are a ton of different kinds of gloves that you can use for cooking. There's just the simple plastic ones you can buy at any store, or there are specific cooking gloves as well. And you want to avoid cross-contamination. Again, this goes back to the raw meat issue. You don't want to contaminate foods that you are not going to cook with the bacteria that could be on raw meat. So what would this look like? If you are going to cut up, let's say, some ground beef, you would have it on your cooking board, and then you transfer that meat to the pan or whatever you're cooking the meat in. And then cross-contamination would be using that same cutting board without cleaning it to cut up really anything else that's not going to be cooked. So if you were going to have a side of fresh vegetables, you would not want to put those vegetables on this cutting board and then, not have them be cooked, because that's when you could transfer those harmful bacteria or pathogens into your vegetables, and then you're eating them raw and getting those bacteria into your stomach. So the recipe that is going to correlate with this week's topic is one of my personal favorites. It is roasted chickpeas. So this recipe is extremely simple to make. Again, this is why it's one of my favorite recipes. It is very quick. All you need to cook it is a baking sheet and an oven. Really only one main ingredient, which is the chickpeas, and then you just need some additional things like cooking oil and spices. Again, if you have any questions about anything, feel free to leave a comment in the comment section. Also, your questions may be answered when we dive into each of these topics more in depth in additional weeks. So maybe you could also hold off on some of the questions for that, just in case we cover it. So I hope you enjoyed this video, and I look forward to talking to you next week.